Now, in order to justify your existence and have people use you, instead of just going to some AI system, there has to be this human presence. And the interesting thing, again, to sort of bring up AI as the counterpoint to this, is
Hmm.
I think a lot of doctors are feeling that AI is sort of hot on their heels, that
Hmm.
like people, that AI may be threatening their jobs, just like in other fields too, obviously. But if as human doctors, we need to bring stuff to the table. We need to
Correct.
bring stuff to the table that justifies our existence. Now, in order to justify your existence and have people use you, instead of just going to some AI system, there has to be this human presence.
Correct.
The way you justify yourself is that you have this human connection with your patients, and the patients want to talk to a person rather than just get like a pill spat out to them. So I do think that AI not only enables you to speak more to your patients because of like the ambient recording thing we were talking about, but it almost requires you to do that more so you can continue to justify your existence in the system. I think the danger of AI is that number one, it could replace a lot of doctors, maybe dermatologists to some degree. AI and the chit chatty doctors, AI is going to be a real threat. And
Hmm.
I think the problem is, and this is because you have a diverse audience of different healthcare professionals listening to this show. If you're a healthcare administrator, I'm sure you're thinking to yourself, well, how could I offload more stuff to AI? How could I
So
have
true.
AI do more things? And so there's going to be a lot of temptation to have stuff that would have been done by higher paid professionals, whether it's the triage nurse,
Correct.
whether it's a doctor, whether it's some of the mid-level providers. This will affect a lot of people. Offloading that to AI, I mean, you're going to be under a lot of pressure to do that because there's so much cost competition. So, as a hospital administrator, you're going to be running into this balancing act where, on one hand, you want to use AI as much as possible to save money, and it might streamline things, and maybe satisfaction will go up.
But again, as you said, it could potentially alienate the overall experience, which is hands-on patient care, providing the best quality care. So there is going to be a balance that's needed in the future of introducing AI into healthcare industry that they continue to evolve and hopefully balance out to share the load of work that is for the patient and also for the employees as well.